It's been 40 years since the first official reports of HIV were announced. It doesn't instill the same fear as it did back then, and the world has made a lot of progress since this time. For example, in 2004, there were almost 2 million people who died from HIV, but in 2019, this number was just over 800,000. However, in 2019, there were also still 37 million people living with HIV, and 65% of these were in sub-Saharan Africa. The 2000s were the heyday of global health funding for HIV. There was huge investments in scale-up of treatment and prevention services and health services in general. Throughout this time, we did see a lot of declines, but funding has dwindled since then, and we see infections rising in 127 countries. So where do we go from here? In the next chapter of HIV, strategies need to focus much more on high-risk groups. These include, for example, men who have sex with men, people who inject drugs, sex workers, adolescents, and the groups that strategies in general have failed to reach in the mainstream. We can't expect that strategies will reach these groups automatically, and they need to be more thought out, targeted, and involve the communities most at risk. Making this harder is that sometimes these groups are even legally discriminated against. For example, in almost 30 countries, men who have sex with men could face the death penalty or up to 10 years to life in prison. We can't expect people facing these kinds of consequences to come forward to access testing or treatment services. This could prevent very promising innovations like pre-exposure prophylaxis or PrEP from reaching their full potential if people can't actually access the services. We need to involve those most at risk in the surveillance, testing, and treatment plans for HIV rather than pushing them underground. The world has come a long way in improving HIV, but still falls short of a vaccine. The COVID-19 pandemic demonstrated that when governments, universities, and countries act together, we can develop a vaccine relatively quickly. It's possible HIV could even borrow the infrastructure from COVID-19 in order to speed up vaccine trials for HIV as well. But in the meanwhile, with over 2 million new infections in 2019, our ability to reach those most at risk for HIV will continue to define the disease's future.